House Bill 2499, having received the required constitutional majority, is declared passed.
The governor's major health care reforms are one step closer to becoming law. Good evening, I'm Brendan Morano.
And I'm Karina Rubio. The Senate passed two bills, the Health Care Protection Act, which makes a number of changes to the insurance industry, and a bill banning short-term insurance plans. State Capitol reporter Theodora Coulivaris explains.
The governor's proposed health care reforms are making their way through the state capitol. The Senate passed two of them, starting with the Health Care Protection Act.
There are 45 voting yea, 14 voting nay, none voting present. And House Bill 5395, having received the required constitutional majority, is declared passed.
This bill makes a number of changes, including banning step therapy. That's when insurance companies make a patient take an alternative, often cheaper medication first, before they will cover treatments prescribed by their doctor. It also aims to end prior authorization for inpatient mental health treatment.
I think the idea is that when they're in that moment of crisis, the 72-hour period, that we provide them with the best treatment possible that hospital may be able to provide.
Insurance companies were neutral on this proposal, and it picked up some Republican votes. Still, opponents are concerned about the plan's more than $50 million price tag.
We keep adding more and more of these costs. This is one more that it's going to be bore solely by working families.
The Senate also passed a bill banning short-term insurance plans, or what has been referred to as junk insurance plans. These are insurance plans people can opt into if they don't get coverage through their job. But these plans don't always cover pre-existing conditions. Because of that, the bill's sponsor says these plans can end up costing people lots of money.
Their prescription drugs were not covered, their emergency services were not covered, and it ended up costing them a whole lot more.
Insurance companies oppose this provision, and lawmakers who voted against this say short-term insurance plans offer people coverage at a lower cost.
And it's an alternative. It's one other option that people have. Yes, it's limited in coverage, but it's a low-cost way for families who cannot afford the ACA or cannot afford a COBRA.
Reporting in Springfield, I'm Theodora Coulivaris.
The Senate also passed the Lieutenant Governor's Birth Equity Initiative. The bill is meant to make care more accessible to people across the state and close racial gaps in maternal mortality.